Cancer remains the second leading cause of death in the United States. Kidney cancer represents one of the most common forms of cancer, with a long-term increase in incidence and poor survival rates for advanced metastatic disease enduring. Therefore, significant unmet need persists to investigate novel therapeutic approaches to improve patient outcomes. Renal Cell Carcinoma, or RCC, accounts for approximately 90% of all kidney cancers, with clear cell (ccRCC) histology representing the majority of cases. Some key characteristics of ccRCC include the overexpression of vascular endothelial growth factor, VEGF, their receptors, VEGFRs, and the accumulation of the hypoxia-induced factor, HIF-2α. These, among others, play critical roles in tumorigenesis, making them viable targets for cancer treatment. Tumors require an increased blood supply and the nutrients and oxygen it carries to sustain their growth and proliferation. Hypoxic conditions are common in solid tumors, which in turn activate hypoxia-inducible factors, HIF, and genes associated with tumorigenesis. VEGF secretion by cancer cells stimulates abnormal angiogenesis to enable rapid cellular division and proliferation, which ultimately influences differentiation, migration, stemness, and immune evasion of the cancer cells themselves. Furthermore, approximately 90% of ccRCC cases have von Hippel-Lindau or VHL gene mutations, which leads to a loss of normal PVHL protein function, which would normally degrade HIF-2α. Therefore, PVHL mutation leads to aberrant activation of the HIF signaling pathway, even in normoxic conditions. The resulting accumulation of HIF-2α allows for its translocation into the nucleus, where it heterodimerizes with HIF-1β, activating a transcription factor complex and its downstream tumorigenic pathways related to tumor cell proliferation, angiogenesis, invasion, immune escape, and metastasis. VEGFR inhibitors block the receptor's signal transduction activity, which discourages vascularization, starving the tumor of nutrients and oxygen. Targeting this mechanism has been successful as monotherapies and in various combinations for the treatment of several cancer types, including RCC. Additionally, blocking the HIF-2α transcription factor is a treatment pathway for certain types of RCC by suppressing the aberrant activation of HIF's downstream targets. Clinical studies are now being conducted to evaluate the effectiveness of combining VEGFR inhibitors and HIF-2α inhibitors for the treatment of RCC. Combining these two mechanisms may enhance anti-cancer effects by addressing both angiogenesis and HIF-related pathways. HIF-2α regulates VEGF expression and has a crucial role in resistance to anti-VEGF therapy. Therefore, it is hypothesized that targeting the VEGF pathway both at the transcriptional level through HIF signaling inactivation and further downstream by blocking VEGF signaling through its receptors may result in enhanced anti-tumor activity and target mechanisms involved in therapeutic resistance. Both VEGFR inhibitors and HIF-2α inhibitors also have independent mechanisms to instigate their anti-cancer effects. Thus, there may be potential clinical benefits for this dual targeting strategy by exploiting overlapping and independent mechanisms to inhibit multiple oncogenic pathways involved in initiation, progression, and metastasis. There are also further possibilities to leverage these overlapping and complementary mechanisms of action while adding immune checkpoint inhibitors to this combination. Both VEGFR and HIF-2α inhibitors have demonstrated immunomodulatory properties with the ability to prime the immune system for immune checkpoint inhibitor blockade. Therefore, a triplet approach may also represent an opportunity to further enhance anti-cancer effects for patients. Clinical studies investigating these combinations are ongoing and can be found on clinicaltrials.gov.